Good morning, my dear students. We shall start with another topic under endocrine system, that is the sex hormones. Here the class of sex hormones are divided into two, that is the male sex hormones and the female sex hormones. Today I will be discussing about the male sex hormones. Okay, brief introduction with the physiology and synthesis of sex hormones. Now, where or what is the site of sex hormones? Sex hormones are produced at the gonads and the inner layer of the cortex of the adrenal medulla. These are the two sites where sex hormones are secreted. Now, what influences or who controls the synthesis and release? As I told you in my earlier class, it is the anterior pituitary which secretes the luteinizing hormone and the follicle stimulating hormone FSH that controls the synthesis and release, where the anterior pituitary is again controlled by the hypothalamus by the gonadotropin releasing hormones. So the gonadotropin releasing hormones in the hypothalamus stimulates the anterior pituitary, which secretes luteinizing hormone and follicle stimulating hormone, which go and act on the respective gonads and secrete sex hormone. This is the process how which sex hormones are produced. Coming to the synthesis of sex hormones or gonadal hormones, they are synthesized from cholesterol. Cholesterol is the starting element for the formation of all the sex hormones or gonadal hormones, which includes a series of steps which is shortening of the hydrocarbon side chain, hydroxylation and aromatization. Here I will show you, in the next slide I will show you how various sex hormones, that is the female and male sex hormones, are produced. Coming to the synthesis with the flow chart, the first it is synthesized, as I told you, it is synthesized from the cholesterol. From cholesterol it forms the pregnenolone. From there it is divided into two steps. One, it forms progesterone, that is a female sex hormone, which is further converted to aldosterone, cortisol and androstenedione, which is a male sex hormone. Now the second part, pregnenolone, will get converted to dehydroepiandrosterone, or shortly we say it as DHEA, which is further divided into androstenedione and androstenediol. Both these get converted to testosterone. From testosterone with two respective enzymes, that is, one is 5-alpha reductase, it gets converted to dihydrotestosterone. With the help of aromatase it gets converted to estradiol, estrone and finally estrol. See, you can see male sex hormones being formed and female sex hormones being formed. Today I will be teaching DHEA, androstenedione and androstenediol plus testosterone. These male sex hormones are collectively called as androgens, and they have a steroid-like structure plus masculinizing features. So today we will be discussing male sex hormones, which includes dihydroepiandrosterone, androstenedione, androstenediol and testosterone. So we will be focusing today on androgen and anabolic steroids. I told you androgens are nothing but these hormones, these male sex hormones collectively are called androgens, which will have a masculinizing features. Plus last I'll have two slides about anabolic steroids. Androgens. As I told you, it is a group of steroids that have anabolic as well as masculinizing effects in both females and males. Here there is no peculiarity that it should only work on males only. It has action on both males and females. The main hero hormone is testosterone, which is the most important androgen in humans, which are synthesized by the gonads. I told you, in the gonads, if it is the male, it is inside the testis. Inside the testis, it is the Leydig cells in the testis. Plus in females, it is the thecal cells in the ovary in smaller amounts, and also from the adrenal glands in both the sexes. So androgens are a group of steroids which has anabolic properties with masculinizing features both in males and females. Masculinizing effects both in male and female. The major androgen, or the most important androgen, is testosterone. The other androgens are 5-alpha dihydrotestosterone, androstenedione and dihydroepiandrosterone, DHEA. So three others include 5-alpha dihydrotestosterone, androstenedione, and dehydroepiandrosterone. These are the other androgen secreted by the testis. Classification of androgens. Two types: natural androgens and synthetic androgens, depending on the site of production from the testis or from the adrenal cortex. Now from the testis it is testosterone and dihydrotestosterone. From the adrenal cortex it is the dehydroepiandrosterone and androstenedione. These are the two natural androgens, two groups of natural androgens depending upon the site. So another one is androsterone. Okay, there is a metabolite of testosterone. Now don't just consider that androgens are only formed or produced in the males, but it is also secreted in the females, but a very minute, or secreted in very small amounts from the ovary plus the adrenal glands. Coming to the second group, that is the synthetic androgens. They are methyl testosterone or fluoxymethysterone, which are 17 alkylated substitute derivatives. Orally effective and lipid soluble ones are also available. Orally effective ones are testosterone andeconate and mesterolone, while lipid soluble include propionate and enatenate salts. Coming to testosterone, as I told you, they are synthesized from cholesterol by the leading cells in the testis. Now, when it starts secreting, it is secreted at the adult level during first trimester, during neonatal life, and it continues after puberty. Now, once testosterone is formed, testosterone is converted by 5-alpha reductase to the more potent 5-alpha dihydrotestosterone, that is DHT, which is responsible for many of the responses to testosterone in the urogenital tract, that is the prostate gland hyperplasia. Okay, that means when you compare testosterone and dihydrotestosterone is more potent. Now it comes and binds and activates androgen receptors, and these androgen receptors are present in many cells like reproductive tissues, skeletal muscles, brain, and kidneys. Coming to the biochemical structure of testosterone, now all the androgens have a testosterone structure which is similar to the steroidal structure, that is 19 carbon atom. Now if you ask me, this is not theoretically important to you, but just to understand. So first, if you see, it is testosterone with the testosterone structure. Now 17 alkylated substitution forms the methyl testosterone and fluoxymethysterone. Just to show the difference, at the 17th position you have an alkyl group, that's it. Okay, this picture I had showed you in my earlier slides, that is synthesis of testosterone from cholesterol. Here I have just erased the female sex hormones and just shown the formation of testosterone, just the formation of testosterone, the synthesis of testosterone from cholesterol. Coming to regulations of secretion. Regulation of secretion, I again mentioned this in my earlier slide. They are controlled by the anterior pituitary and by the secretion of LH and FSH. Now, FSH is important in spermatogenesis. Okay, and LH, with the help of leading cell, they secrete testosterone. Then feedback mechanism. When there is high testosterone, it will inhibit the luteinizing hormone, while also if estrogen level is also present, it gives a feedback inhibition, plus inhibin also inhibits FSH secretion. Plasma level of testosterone is always 0.3 to 1 microgram per deciliter in males and 20 to 60 nanogram per deciliter in females. Okay. In my picture on the right side shows the regulation. In my previous slide I told you GnRH from the hypothalamus influences the anterior pituitary, which stimulates the anterior pituitary to stimulate LH and FSH, which comes and acts on the testis. Here the main organ is testis and leading to the formation of testosterone. And from testosterone, estradiol is also formed. So if there is increased estradiol, negative inhibition; increased testosterone, negative inhibition. Okay, and also another hormone which is secreted by the testis, inhibin, also leads to inhibition, giving a feedback inhibition to the anterior pituitary. The pharmacological action of testosterone. The first and foremost action of testosterone is androgenic effect. Now when the effect starts, it starts in the fetal life itself. Testosterone promotes the development of the male reproductive tract, which includes internal genitalia, vas deferens, epididymis, and the external genitalia, which includes the sex differentiation. Now, in the pubertal stage, what happens or what does testosterone do? It leads to the formation, it gives or it helps in the development of two characteristics: primary sexual characteristics and secondary sexual characteristics. Primary includes enlargement of the penis, scrotum, and the testis. Secondary sexual characteristics includes the male body shape, formation of axillary pubic hair, deep pitch of the voice, thickening of the skin, where there is greasy and loss of subcutaneous fat. In adulthood, it will lead to baldness, BPH, benign hypertrophy of prostate, and sometimes prostatic cancer. Now, in the testis, what does this androgen do? They help in the promotion of spermatogenesis and maturation of the sperm. Moderately high dose of testosterone can cause testicular atrophy by inhibiting GnRC, and that is a negative inhibition. As I told you, if there is increased testosterone formation, there is a negative inhibition to the brain that there is a lot of testosterone produced. So inhibit the formation. That will lead to testicular atrophy. In higher doses, direct sustaining effect and can cause lesser marked atrophy. Moderately higher doses will lead to testicular atrophy, while a very higher doses sustained effect and it will cause lesser atrophy. Now, the anabolic effects of testosterone. What are the anabolic effects? In boys and girls, both. Pubertal spurt of growth at puberty. Bone growth, that is the increase in thickness and length of the bone. Estrogen from testosterone will help in the fusion of bones and mineralization. Plus, in skeletal muscles, it helps in muscle building, and also positive nitrogen, mineral, and water balance, which helps in increase in weight. It also helps it to increase appetite and acceleration of erythropoiesis. These are the anabolic effects of testosterone. Now, this is sometimes misused by the gym workers. See, I told you muscle building. Sometimes these are injected into the bodies to artificially increase your muscle mass, etc. Okay. Once again, anabolic effects includes a pubertal spurt of growth, bone growth. Estrogen from testosterone helps in the fusion of bones and mineralization, muscle building, positive nitrogen, mineral, and water balance. Plus, it helps in increasing appetite and acceleration of erythropoiesis. The target organ of action, where androgens go and act. I told you, androgen, with the help of 5-alpha reductase, it is converted dihydrotestosterone. They come and bind to the androgen receptors. This go and act to the external genitalia, leading to differentiation during gestation, maturation during puberty, and in adulthood it causes prostatic disease. While hair follicles increase growth during puberty. Testosterone directly go act to the androgen receptors, act on the internal genitalia, Wolffian growth development during gestation, skeletal muscle increase mass and strength during puberty. In and erythropoiesis plus bone mass, with the help of estrogen, they cause fusion of the bone. Estradiol comes and bind to the estrogen receptors, go and bind to the bone, epiphyseal quotient, increase density, and sometimes, and in some cases, libido increases. Mechanism of action. Now, mechanism of action, as I told earlier, it is just the androgen receptors. Both the testosterone and the dihydrotestosterone come and act via the androgen receptor, which are nuclear family superreceptors. This much is needed for your knowledge. No need to go into detail. That is, into detail is nothing but if there is any mutation in the androgen receptor, what happens? There will be incomplete sexual development. That is, the testosterone will be formed, but no androgen receptors. No binding takes place and failure of sexual development. Another disease, that is Kennedy's disease, which results in spinal and bulbar muscle atrophy. Now, there are estrogen receptors. As I told you, testosterone will lead to helps in the formation of estrogens also. Now, they are converted to estrogen with the help of CYP19 CYP19 microenzymes. Now, these enzyme deficiency can also lead to estrogen deficiency plus estrogen receptor deficiency, leading to failure of fusion of long bones and osteoporosis. So, I hope you understood what is the importance of these receptors. Even if the receptors are absent, many sexual deformities or incomplete sexual development takes place. Okay. Coming to the pharmacokinetics of androgens, absorption, It undergoes high first pass metabolism, so it is ineffective orally. Usually given IM injection or synthetic preparations are commonly used. Transportation, it is highly protein bound in plasma to albumin as well as sex hormone binding globulins. Then metabolism, it is metabolized by the liver enzymes into androsterones and ethiocholanolone, okay, excreted by the urine after conjugation, and small quantity of estrogen also produced from testosterone but not from fluoxymethysterone and dihydrotestosterone. Only from testosterone estrogen is formed, not from these two forms. Coming to therapeutic uses of androgen, where, how and what forms of androgens are used in therapy. Usually, uses of androgen are for androgen replacement therapy. They use derivatives of testosterone rather than androgens. Why? Because they are safe, effective and easy to monitor. Now, the first use of androgens are nothing but for androgen deficiency. Androgen deficiency. Where do we have androgen deficiency? Now this is a clinical diagnosis confirmed by hormonal assay tests. Okay. Now this androgen deficiency can be caused at the testicular level or at the hypothalamic pituitary level. Testicular level where there is high LH and less testosterone. High LH, as I told you, will lead to less testosterone secretion. And again by the hypothalamic pituitary disorders, that is any disorder there will lead to low LH and low testosterone. This finally leads to the final impact is decreased testosterone. Our goal is to maintain the normal testosterone concentration as closely possible, okay, by serum concentration monitoring. Now, if you leave it untreated, no shortening of life will be there, but it will be associated with significant morbidity, that is ambiguous genitalia, delayed puberty and infertility. All the functions of testosterone will be lost. Now, this is treated by androgen replacement therapy, usually for the remaining part of the life. The main aim is to restore tissue androgen exposure by causing natural androgen testosterone. The next use, hyperpituitarism. In hyperpituitarism also, as I told you, pituitary, there is no stimulation or any disease in the pituitary can cause the decrease in the formation of LH-FSH, which leads to further decrease in the formation of testosterone. Here, monitoring at anticipated time of puberty is a must, and this is required for the primary and secondary sexual characteristic development. The next use, AIDS-related muscle wasting. I told you testosterone has an anabolic effect on the muscle, increases the muscle mass. So it can be given in patients related or having muscle wasting. Then it can be given for patients with hereditary angioneurotic edema. The methyl testosterone form is usually given. And finally, aging. Now, if you ask me, misuse. Some people misuse testosterone. It involves prescription with no acceptable medical indication. Example for misuses are male infertility, male sexual dysfunction or impotence, and male menopause. Now, no convincing evidence that has shown that androgen therapy is effective or safe for older men unless it is frank androgen deficiency. That is, unless there is androgen deficiency, then only these testosterone will be useful. If testosterone are present and you simply give testosterone externally, no use it will give. Coming to the side effects or adverse effects of androgen. In androgen, in females, it is virilization. This is mostly seen in women who are receiving high doses for a prolonged period, such as in estrogen-dependent mammary carcinoma. What does virilization include? Virilization includes hirsutism of face, that is excess of body hairs, deepening of voice, which is irreversible on prolonged treatment, and also menstrual irregularity, frontal hair loss, and also acne and clitoral enlargement. Masculinization of female fetus may occur if it is given during pregnancy. The first and the foremost side effect or adverse effect is virilization. Second is cholestatic jaundice. This is mostly produced by steroids having 17 alkylated substitutes. Third one, priapism, that is nothing but painful and sustained erection of penis. Then oligospermia and edema. Edema is due to the promotion of salt and water retention. Then precocious puberty and short stature. Suppose we anticipate this patient has testosterone deficiency and we administer them at an early age will lead to precocious puberty and fusion of the bones due to the formation of estrogen. Then acne and hepatic carcinoma with gynecomastia. These are the side effects of androgens. I repeated: virilization, cholestatic jaundice, priapism, oligospermia, edema, precocious puberty and short stature with acne, hepatic carcinoma and gynecomastia. These are the side effects of androgens. Again a small topic: anabolic steroids. What are anabolic steroids? They are nothing but synthetic androgens with a higher anabolic property but a lesser androgenic activity. So there is lesser virilizing effect. They act in the similar way as androgens by binding to the androgen receptors and has the androgenic effects. The examples for anabolic steroids include nandrolone propionate, nandrolone deconate and stanozolol. Now these three names should be known because for your exam, name 3 anabolic steroids or name 2 anabolic steroids are usually asked, nothing else from anabolic steroids. Sometimes what are anabolic steroids can be asked. Coming to the therapeutic uses of anabolic steroids are used in catabolic conditions like in acute illness, severe trauma and major surgery, as it helps in increasing appetite and also in muscle mass. Then it comes to renal insufficiency, osteoporosis, since it helps in the bone formation and mineralization, suboptimal growth in boys, and also in anemia, as it helps in erythropoiesis and also in performance enhancements. Now these performance enhancements by anabolic steroids are misused. A larger dose of testosterone in both males and females will increase the muscle mass and performance. So these are unethically used by these athletes before their event, and once it is known, they will be disqualified from their event. Okay, now this is how they are misused. This performance enhancement property is misused by these athletes during their events. They are taken just half an hour or 1 hour before the performance, which increases the strength and performance. They come now this group of drugs come under the dope test. Dope test are those drugs which are tested before any athlete goes for their performance. A few drugs come under this group. One among them is anabolic steroids. If they find out in the plasma there is anabolic steroid, they will be disqualified from their event. Thank you all. With this we finish today's class about male sex hormones. So male sex hormones consist of testosterone, dihydrotestosterone, dihydroepiandrosterones. Okay, you should know the mechanism of action, the pharmacological action of testosterone and the uses of testosterone, where and how it is used. Plus the next topic about anabolic steroids. What is anabolic steroid? What is the advantage of anabolic steroid and where it is used and how it is being abused. These things should be known. Okay. I hope this presentation is much clear and at a louder voice. Some of you had mentioned that my voice is very soft or low in the previous recordings. I hope this is okay for everyone. If any doubts, clarifications, please do comment in the box. We are here to help you. Thank you, and the next class will be on female sex hormones. Okay, if you have completely finished hearing my slides, please do comment your name and roll number in the comment box so as we can mark your attendance. And thank you once again.